Hello everyone, welcome back to the channel. Have you ever taken a tablet and wondered how does this medicine actually work inside my body? Like it's just one small pill, right? But after you swallow it, it starts a full journey inside your body. In this video, I will explain step by step what happens after we take a medicine in a very simple and clear way. So let's begin. Medicines are made to fix a problem in the body like fever, pain, infection, acidity, allergy, and many more. But the medicine doesn't work instantly in most cases. It goes through different steps inside our body, like entering the body, getting absorbed into the blood, reaching the correct place, working on the target, and later getting removed from the body. Think of it like a delivery package. It has to go from your home to the correct address, right? Similarly, medicines has to reach the correct place in your body. After we take a medicine, mainly these things happen. The medicines enters the body, it travels through the blood, it acts on a specific target, and then it produces the desired effect. So overall, medicines work only when it reaches the correct target. First step is how medicines enter the body. There are different ways. Tablet or capsule, we swallow it. Syrup, also oral route. Injection, it enters directly into blood. Now here's something important. The route decide how fast the medicine works. For example, if you take a tablet, it takes time because it must dissolve and get absorbed. But injection is faster because it directly enters the blood. That's why in emergencies, doctors often give injections. Now, after entering, the medicine must go into the bloodstream. This is called absorption. Most absorption happens in the small intestine, but absorption depends on many things like the type of medicine, how it is made, tablet, capsule, syrup, and even food. Example, some medicines work slower if taken with food, while some work better with food. That's why doctors sometimes say take after food or take on empty stomach. After absorption, the medicine enters the blood. Now, blood works like a transport system, like roads and highways. Blood carries the medicine to different organs like brain, heart, liver, muscles, stomach. But the medicines will only work where its target is present. So, medicine may travel everywhere, but it acts only at the place where it finds the correct target. This is one of the most important parts. Medicines work on targets such as receptors, enzymes, proteins, or bacteria or viruses that the medicine attaches to the target and creates an action. A very easy way to understand this is the lock and key mechanism. Imagine this medicine is the key. Target receptor is the lock. If the key fits into the lock, the medicine works. If the key does not match, it will not work. That's why one medicine works for fever, another medicine works for allergy, and another works for infection because every medicine has a different key shape. Let's take a very common example, paracetamol. Paracetamol is used for fever, mild to moderate pain like headache or body pain. It works by acting on brain centers that control temperature and pain signals. But one important point, paracetamol does not kill bacteria. So if someone has a bacterial infection, paracetamol may reduce fever, but it will not treat the infection. That's why doctors may prescribe antibiotics only when needed. After the medicine binds to the target, it produces the effect. These effects can happen in different ways. It can block signals, example, painkillers blocks pain signals. It can activate some response, for example, some medicines increases insulin release, or it can kill microbes. For example, antibiotics kill bacteria, So the final goal is always to reduce symptoms or fix the disease cause. Now you may have noticed something. The same medicine works great for one person but not the same for another person. Why? Because every human body is different. Some main reasons are age, children and elderly react differently. Body weight, dose depends on size. Genetics, body processes drug differently. Liver and kidney function, these organs clear drug. That's why self-medication is risky. Always follow the correct dose and medical advice. After the medicine finished its work, the body needs to remove it. This happens in two steps. The medicine is broken down in the liver. This is called metabolism. Then it is removed by the kidneys and goes out through urine or stool. That's why liver and kidneys are very important for medicine safety. If someone has liver or kidney disease, the medicine does must be adjusted. Dose must be adjusted carefully. Now let's talk about side effects. Side effects happen because sometimes the same target it is present in different organs. So the medicine may bind where we don't want it to bind. Example, a medicine designed to act in the stomach may also affect the brain or heart and cause side effects. Also, side effects can be dose related. Higher dose equals to higher chances of side effects. That's why taking extra tablets is not safe. In summary, so let's quickly summarize the full journey of medicine. Entry into the body, absorption into blood, transport through blood, target binding, produces effect, removal